Well, President Donald Trump is committed to making America great again. He's also committed to making America healthy again. And that is why Trump nominated RFK Jr. to run the Department of Health and Human Services. HHS oversees agencies like the CDC, the FDA. But as you can imagine, mainstream media is already on the attack, with outlets like the Associated Press and NBC News saying Trump has chosen anti-vaccine activist RFK Jr. to run HHS. And joining us now to talk more about this is Dr. Peter McCullough. Dr. Peter McCullough, as always, good to see you. Thanks so much for being here. I mean, during COVID, you were so outspoken. You've also been on the receiving end of mainstream media calling you all sorts of names. Your reaction to Kennedy's nomination?
I think it's probably Trump's most courageous nomination, Robert F. Kennedy Jr. for Secretary of Health and Human Services. You know, over a dozen agencies report into HHS, hundreds of thousands of employees, and RFK has a tremendous range of administrative as well as substantive interests in improving the health of America. I think it's a terrific choice. Robert F. Kennedy is going to bring in a team of clinical and scientific experts that will make America healthy again.
Well, I mean, so, he's been called the anti-vax guy. Smart people in the medical industry, they're up in arms. I mean, you're hearing stories, they're scared. I mean, in your opinion, how will he unite the country and make make great policy decisions? So, I guess my point is, what's so controversial about making America healthy again?
It's not controversial, it's unifying. And what he's going to do is he's going to bring us back to the normal processes that we have in healthcare. And I've been to Washington now for decades as an internist and cardiologist. What we do is we frame issues, we identify experts and stakeholders, bringing in academia, the practice community, pharmaceutical companies, foundations, and our federal agencies. And then we, get a consensus on an issue and then drive public health policy. That's the way it's supposed to happen. During COVID, all of that was suspended, and we've had two HHS secretaries that became very autocratic. And so now we're going to get back to usual processes. Kennedy is not quiet. He likes to have different points of view. As you pointed out, he's taken more than his share of criticism. He's unfairly characterized in one area. He, like myself and so many other people in healthcare, we want safe biopharmaceutical products, and that applies to vaccines.
So what kinds of changes do you think, we're going to see? We're going to see in the food industry, in the medical field. I know he's talked about, unhealthy food, like unhealthy cereals, dangerous seed oils, improving our water supply. What do you think we're going to see?
Low-hanging fruit initially will be getting trans fats out of the food supply. 2009, the American Heart Association had a scientific statement saying we should ban trans fats from the American diet. WHO agrees. Bloomberg in New York City did it, and they've had a reduction in heart attack rates. Trans fats like partially hydrogenated soybean oil or these seed oils, Kennedy's right. They need to get out of the food supply, out of fast food restaurants. That's going to be probably one of the first easy tasks that he does as HHS secretary through the USDA. And then we'll see us move on to other issues. There are now analyses about fluoride in aluminum in the water supply related to cognitive function. We're going to reevaluate, how much is that really needed? And I think then we'll move on to biopharmaceuticals.
You think it's not going to be an uphill battle for him? With all of the industries to get all the trans fats out, the fluoride out of the water supply. Is that going to be an uphill battle? Or the way you're saying it, that's going to be the easy part?
Well, in areas where all the experts and societies agree, like trans fats, that's just going to be an execution issue. In fact, the FDA has been trying to do it. It's just been at a snail's pace. There's no substitute for bringing people in together, face-to-face meetings. What we've had in my field in cardiology, Bethesda meetings, where we all get together and ultimately sit down. We know we have different viewpoints. We examine the evidence, get a consensus, and go forward. Now, things will happen when everyone's brought to the table, and that includes the biopharmaceutical industry. One of the things I anticipate is rescinding the 1986 Vaccine Injury Compensation Act, and that means removing the liability shield for the companies. So vaccine companies, just like drug companies, would face standard liability regarding their products and complications. You'll probably see the companies, withdraw a lot of antiquated unneeded vaccines at this time that would just, basically be risk for them. And things will clarify. The markets will clarify when that legislation is rescinded.
Yeah, I was going to ask you about the vaccine industry because there, are a lot of concerns from parents in states like California, where their kids are mandated to have all these vaccines to go to schools. RFK Jr. from California, could he have an impact? I know he can have an impact on a federal level, but how does that work state to state?
States differ in terms of exemptions from mandated childhood vaccines. Texas has philosophical, religious, and medical exemptions, whereas California effectively has none.
Right.
You can see the differences. Obviously, the same diseases affect the same states. There may be actually a federal ban on all mandates that relate to vaccines or even drugs, for that matter. No one should be forced against their will to take, any drug or vaccine. They should receive no pressure, coercion, or threat of reprisal. That's a fundamental, inalienable right, and we may see that. And that way, things will clarify relatively rapidly. People, who feel good about vaccinations and they're in line with their doctors on this, they'll continue to take vaccines. Others that have concerns or questions regarding safety, particularly when there's a family history or personal history of previous reactions, they could decline vaccines without suffering any penalty in terms of the child's education or future development.
RFK Jr. has also said that on day one he would fire 600 people. What does that look like?
That's not much compared to a couple 100,000 employees. So we're probably talking about leadership. And, we do need new leadership at the big agencies, CMS, as well as Medicare, Medicaid, the CDC, NIH, and FDA. It is time for new leadership. And that new leadership, I hope, are very strong on clinical issues. One of the things we saw with Anthony Fauci, the White House task forces, for instance, none of them were qualified doctors who saw patients sick with COVID-19. America never got updated from our government about what we should do to prevent hospitalizations and deaths. My input would be, let's have real doctors in Washington providing real advice, doctors who are grounded in clinical practice, actively publishing and can communicate with the public.
So you're excited about this?
Very excited. I think there couldn't have been a better nomination. And, this is a dizzying set of nominations now. But as I said, I think the RFK nomination may be the biggest one of all.
Yeah, it was huge. Dr. Peter McCullough, as always, good to see you. Thank you so much.
Thank you.
Thank you.